With the Delta variant on the rise, the White House is keeping current travel restrictions in place. And some states like New York and California are requiring all city workers be vaxxed or get tested weekly. The Department of Veterans Affairs is now the first federal agency to require its 115,000 healthcare workers to get COVID-19 vaccines. This comes as a new report finds a startling high suicide rate among war veterans who served after 9/11. And schools are opening back up, but students might not be going back. There's a rise in homeschooling as many parents say it's beneficial for kids. Tune in to Deep Dive as we explore these topics and more. Hello and welcome. This is Deep Dive and I'm Tiffany Meier. As summer is in full swing and people are traveling for vacation, what's the current travel restrictions? The U.S. is maintaining current pandemic-related travel restrictions. That's due to the spread of the Delta variant.
We will maintain existing travel restrictions at this point for a few reasons. The more transmissible Delta variant is spreading both here and around the world.
This comes just 1 week after the CDC advised Americans to avoid travel to the U.K. The U.S. currently prohibits entry to most travelers from Europe, China, India, and several other countries. The U.S. first imposed travel restrictions in March of 2020. The travel industry and U.S. allies have been urging the Biden administration to lift restrictions. But in the last 2 weeks, the number of virus cases is up by about 170%, and the death rate is up almost 20% compared to the week before. And some states are cracking down. Following New York Mayor Bill de Blasio's announcement that all municipal workers must get the vaccine or be tested each week, California is following suit. Governor Gavin Newsom and health officials announced that state employees and healthcare workers will be required to provide proof of vaccination or get tested regularly. The effort aims to get more Californians vaccinated as more cases of the Delta variant are being reported.
California is committed to vaccination, verification, and or testing on a weekly basis. We're not stopping just with state employees. Today, we're also announcing partnerships that include those like Kaiser, private sector now stepping up, organizations representing physicians and dentists, dialysis clinics stepping up, private sector clinics are committing to the same.
Testing will increase to twice a week in high-risk and vulnerable settings like nursing facilities. Newsom said the new health order will take effect on August 9th and must be fully complied by August 23rd. But the governor has not imposed new requirements on mask wearing or social distancing since June 15th, the reopening date. He faces a recall election as residents are unhappy with the way he handled the pandemic, leaving businesses and schools shut down longer than other states. And New York's move will start September 13th. Now, as to vaccine mandates, the Department of Veterans Affairs is now the first federal agency to mandate them. The VA is now requiring its healthcare employees to get fully vaccinated against the virus within 8 weeks or face termination. They are the first major federal agency to require vaccines as a condition of employment. The mandate applies to Title 38 employees. That includes doctors, dentists, nurses, and some other healthcare workers. The VA move comes a day after almost 60 medical groups, including the American Medical Association, signed a joint statement calling for all healthcare employers to impose vaccine mandates. The statement says healthcare workers have an ethical commitment to get vaccinated. Last month, the Biden administration said federal agencies generally shouldn't mandate vaccines as a condition of employment. Just hours earlier, White House Press Secretary Jen Psaki didn't mention the mandate in her press briefing. A reporter asked if it would be illegal for the federal government to mandate vaccines.
It hasn't been determined that it would be illegal, no, but we have not made a determination about that, no.
But since the FDA hasn't granted full authorization for any of the vaccines, many see mandates as illegal. That's a stance shared by Matthew Staver, an attorney and chairman of Liberty Counsel. He tells the Epoch Times he doesn't think a government mandate is legal, especially because the vaccines are only authorized for emergency use. Republicans have generally been against vaccine mandates. Republican Senator Ron Johnson released a statement saying no one should be pressured, coerced, or subjected to reprisal for refusing a medical treatment, including the COVID vaccine. But some see it as a good move. Bioethicist at the University of Pennsylvania, Ezekiel Emanuel, is in favor of vaccine mandates. He says he expects more healthcare employers to impose mandates and that it will ripple beyond the healthcare industry. He thinks the nation will be better off for it. And now, speaking of the Department of Veterans Affairs, a new report reveals an alarming trend among veterans who served in wars after the 9/11 attacks. Brown University's Costs of War project released a report last month. It found a sharp rise in suicide rates among those who served in wars after 9/11, including Afghanistan and Iraq, as well as deployments in 5 other spots around the world. The report found over 30,000 have killed themselves. That's compared to the over 7,000 who died in combat. That's also a drastic rise compared to the general population. The report found the suicide rate among veterans is 1.5 times that of the general population. Adding the rate of 45.9 among veterans aged 18 to 34 is 2.5 times that of the adjusted general population. The report states active service member suicide rates have grown during the global war on terror to surpass any service member suicide rates since before World War II. Statistics on active duty suicides suggest that rates among veterans of the terror wars could be some of the highest in 80 years. Suicide rates among veterans used to roughly match that in the general population. And among active service members, suicide rates typically fall during wartime, with the exceptions of the Vietnam War and the global war on terror. The report notes several reasons for the trends. Historically, it boiled down to factors such as stress and burnout, access to firearms, the difficulty of reintegrating into civilian life, and a military culture that doesn't prioritize mental health. But what caused the changes after the terror wars? The report notes, unlike the public celebratory treatment of World War II veterans as heroes, sections of the public have met the return of veterans from Vietnam and the War on Terror with hostility for the former and often disinterest for the latter. It goes on to state if there is something novel to the global war on terror, it may be the diminishing approval and ignorance of the public, coupled with persistent veteran stereotypes, which further alienate them from civilian society. Another factor is the use of IEDs in the war or homemade bombs. That's led to a spike in brain injuries among combat vets. Many of these brain-injured vets are redeployed, which increases their mental trauma. The study notes another factor is moral injury. It states perceived transgressions against one's sense of morality had the strongest association with ongoing suicidal ideation among 151 active duty military personnel, compared with transgressions of others or betrayal by others. The report also notes instances where the Department of Veterans Affairs has failed America's veterans. It notes the department failed to spend millions of dollars set aside for suicide prevention outreach. It goes on to note, worse, 31% of denied or rejected non-VA emergency care claims were inappropriately processed in 2017, meaning veterans had to take on the financial burden of health care for an incredible sum of $716 million. The report ends by stating that DoD, Pentagon, VA, and other actors should take moral injuries, military sexual trauma, and other traumas outside of the theater of war as seriously as physical wounds and more readily diagnose and respond to them. Unless the U.S. government and U.S. society make significant changes in the ways we manage the mental health crisis among our service members and veterans, suicide rates will continue to climb. And now, before we end, schools are back, but students may not be. That's because more parents are opting to homeschool their children, even after the pandemic. They say it's beneficial for kids. While the pandemic has proved largely disruptive for most families, a few parents say they found stay-at-home orders helpful in homeschooling their children. Some explain their children have special educational needs, with others seeking faith-based programs. Still more say they see shortcomings in their local schools. They opted for alternative education long-term, after many were thrown into a homeschooling trial run this year. According to the U.S. Census Bureau, the rate of homeschooling rose by 11% by September 2020. That's double the figure from 6 months earlier. And as for those who are returning to the classroom, Senator Josh Hawley announced a new bill called the Love America Act, which aims to combat the rise in critical race theory that's being taught in classrooms. He told Fox News host Tucker Carlson last Thursday his bill would combat the, quote, misinformation the left is spreading, that the U.S. is systemically evil and racist. Hawley says that's not true. This is a great nation. We are a nation of liberators. It's time to reclaim that and to teach our children who we are, who they are. And that's why my bill would say, listen, if a school district gets federal money, you've got to teach the basic truth about the country, the Constitution, the Bill of Rights, the Declaration of Independence, the Pledge of Allegiance. These are the things, the documents that express the ideals that unite us as Americans. He went on to say, you've got to replace the lies with the truth. And that's what I'm trying to do. Hawley posted on Twitter saying, replace the lies with the truth. That's what my Love America Act is all about. No more critical race theory in schools. Teach our kids the truth of who we are, a nation of liberators. But what do you think? Let me know below. Thanks for tuning in to Deep Dive. I'm Tiffany Meier, and see you soon.